In this module, we're going to examine the neck and chest of a trauma patient. Be structured and systematic, as this will help you to avoid missing injuries. Before starting the examination, ensure that the patient is stable and comfortable. Wash your hands and use PPE as appropriate. We recommend using the look, feel, test system of examination. We recommend dividing your examination into discrete zones. These zones are the neck, thoracic cage or skeleton, lungs, and the heart. Use the look-feel test system to examine each zone. In the neck, look at the anterior neck for any soft tissue injury, swelling, or foreign body. Feel for any subcutaneous emphysema in the neck. Feel the larynx and trachea for tenderness or crepitus, and check for any bruits. Test the patient's voice, their ability to swallow, and perform a neurological examination, including checking for a Horner syndrome. In the thoracic cage, look for any seatbelt sign, contusions, or soft tissue injuries. Look for abnormal chest wall movement with respiration that may indicate a flail segment. Don't forget to note any clavicular or scapular deformities. Feel the thoracic cage for subcutaneous emphysema. Feel for clavicular, rib, and sternal tenderness or crepitus, which may indicate a fracture. Test whether the patient can take a deep breath and cough without limitation by pain. For the lungs, look for any hemoptysis and observe whether the chest expands symmetrically on either side. Auscultate the lung fields for intensity of breath sounds and signs of pneumothorax or hemothorax. Test the patient's oxygenation on room air using a pulse oximeter. For the heart, test the symmetry of peripheral pulses and auscultate the heart for cardiac murmurs. That concludes the neck and chest examination. To finish off the examination, always document your findings in the health record. Abnormalities in examination should be reviewed with a senior colleague, and specialist referral may be appropriate depending on the injury. Consider the functional impact of the injuries and update the patient's ACC and insurance paperwork accordingly.